Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Hi, everyone. Welcome to our local information COVID-19 program here on KSJE. It is Thursday, April 16th.
It is Thursday.
Welcome back.
Welcome back.
Yeah.
They didn't take me out last night.
I'm glad no one took out Megan.
Yeah. Did you howl at the moon last night?
You know, I missed howling at 8 o'clock.
Me too.
I'm part of the Facebook group that tells me to do that, and I missed it.
It's a national Facebook group, and it's called specifically what? Howl at 8 p.m.?
Howl at 8 p.m. Yeah, it's very specific.
It's super specific.
Oddly specific.
It's very, but there's no pictures or videos of people howling at anything. But
No.
there's 500,000 Americans in this group.
The cover photo is monkeys howling.
Right, the howler
Yeah.
monkeys.
And then they're doing a poll to pick a new photo. But anyway.
500,000 Americans. It's crazy. Anyway.
Thanks for that.
I know.
Yeah. Okay.
There you go. Fun fact.
Anyway, we're glad that you're with us, everybody. This is our program that we do Monday through Thursday at 9 a.m. on KSJE. It is rebroadcast at noon at our partner stations, KNMI 88.9, and again here on KSJE Radio at 5 p.m. 90.9 to present local information about COVID-19.
Yes,
And
that's
so
what we do.
That's what we do. And so we have some guests who are with us.
They stuck around.
They stuck around after my show earlier on the radio.
Which is always an amazing triumph.
Yeah. Yes. Okay. Sure. So Crystal Ariano is here from our communications center. Crystal, welcome.
Thank you.
Thank you for being here. Devin Neely is here from San Juan County. Devin, again, welcome.
My pleasure to stay, Scott.
Thank you for staying. We did open the door briefly.
It's Devin's pleasure.
You could have escaped, but he didn't. So that is okay. But the reasons that they're here is to talk a little bit about dispatch and 911 and some different protocols, because there have been this report this week about 4 first responders who may have been exposed to COVID-19. And so, again, Devin put out the information that it was 2 San Juan County firefighters and 2 San Juan County sheriff's deputies who may have been exposed on a call.
Correct. And real basically, our folks showed up to a call with a lower level of PPE based on advisement from the dispatch center and the information that they got off of the 911 call. The patient was transported, and later we were contacted by the State Department of Health informing us that that patient that was transported had tested positive for COVID-19. We have those deputies and those firefighters being monitored. They'll be tested, and as soon as we have test results back, they'll be allowed to return to work, providing those test results are clear. But you know, the big deal is dispatchers are going to ask a lot of questions when you call 911, and they ask those questions so that our first responders are properly prepared to respond to your call. Not only do they bring the right equipment, but are they wearing the proper PPE? And this is a whole new world that we're in right now. This is not a conversation that we had to worry about just 3 months ago. But now, to keep our front line healthy, the dispatchers have to be asking these questions, and we have to get truthful answers.
True. That's very true. And Crystal, again, your dispatchers are now being trained on this new procedure?
Yes, absolutely. We're working with each one of them just to make sure they're asking the right questions and they understand where to go from different points in our protocols. Got
you. And so, again, it's just important that folks understand why this is being done. And the reasoning behind it. Megan? Chime in on? Are you good?
I know,
you
surprisingly. Well, I just feel like that's pretty straightforward, which is good. That's what I want in my dispatcher.
There you go.
Right?
We all want that.
I don't want any, how are you, feeling emotionally right now? I want some basics. So what kind of questions are those?
So we're asking every caller, that means police, fire, and medical. We want to know if they have a fever. We want to know if they're complaining of any shortness of breath. Do they have chills, a persistent cough, or any new respiratory systems? As of day before yesterday, we actually started asking specifically, have they tested positive for COVID-19?
Right.
There you go. And so that's working so far, and allows then your first responders to then suit up or not suit up or respond appropriately is, I guess, the idea.
Yeah.
And what I can say about the fire department is they've instituted new protocols that every responder on every call is going to be wearing at the very minimum a surgical mask. If we are advised by dispatch that the patient has symptoms or is COVID positive, or there's some reason for dispatch to believe that there is necessity to, that mask will be upgraded to an N95. The first responders will be wearing glasses with any contact with a patient.
Gotcha. Good to know. Very good. Well, thank you both for sticking around and sharing that new information with us about how the dispatch center is responding to this. It's really an evolving situation, I mean, isn't it? It really changes hour by hour almost.
Absolutely.
And so that's important. So very good. Thank you both very much.
Well, thank you so much for having us, and we're going to duck out of here.
Okay. All right. We'll let you do that in 1 second. We're going to get to our next
We don't want to get that on
segment.
camera.
No, we don't want to see you sneaking up behind Megan.
No, because you're really better torso up, so.
There you go.
You know what? We're going to get to hear about the evolving situation because next up we have 3 physicians from San Juan Regional Medical Center.
We do. They joined us, and we're going to be talking with them a little bit about what's been going on. So
That's
let's play that right now, everybody. Here we go. Joining us now to talk a little bit about the conditions and issues at San Juan Regional Medical Center, and with the COVID-19 virus, we have 3 physicians on the phone with us this week. How about that?
Triple
right?
the fun.
That's right. Dr. Jared Myers is joining us, and Dr. Brad Greenberg again. Both are emergency medical physicians from San Juan Regional Medical Center. Good morning, gentlemen.
Good morning.
Sir.
And Dr. Aaron Philpott is back with us as well. Dr. Philpott, good morning to you.
Good morning.
Thank you for being with us, and let's get started. Can you give us kind of an idea of current conditions at San Juan Regional Medical Center? How are things going with the numbers of patients that you're seeing? Who would like to start?
I can. This is Brad. I can go ahead and talk about that some.
Okay.
We've got currently in our hospital we have 109 people who are admitted to the hospital, and we have 32 of them are either COVID positive or they have results that are pending, and it seems like they may be COVID positive. We have a modest number of patients that are also on ventilators. 6 of those patients are on ventilators. We've taken care of 50 patients with who have been COVID positive so far in the inpatient setting, and we've been hard at work at trying to do testing. Also, we've done a total of 1,031 tests, and continue to do testing. Also, located in the emergency department, located at our drive-through screening, which is Monday, Wednesday, Fridays, 10 to 2, and arranged by our ongoing COVID screening line. And could I mention what that number is?
Yes, please.
So the COVID screening line to talk to a registered nurse who can answer calls with questions related to COVID-19 and go through a process to understand if you should be tested, that number is 505-675-4722. And so there will be someone there, roughly business hours, 8:30 to 4:30, Monday through Friday, to answer those questions and to help folks navigate whether or not they need a test or not. So we are fully in the swing of a COVID-19 response, engaging our medical staff and our staff, as well as our facility, to make sure that we're ready to take care of all the challenges associated with COVID-19, but also continuously ready to take care of any acute problems that are non-COVID-19 related in the community. I think it's really important for, even as we ramp up and are trying to make sure that we address the COVID-19 needs, we want to make sure that folks also understand that we at San Juan Regional, a community-owned and operated hospital, we care for any emergencies, heart attacks, chest pain, strokes, new weakness, difficulty speaking, those kinds of things, and trauma. We want those folks to come to the hospital. We don't want them to be home and either explain away their symptoms or worry about what's happening with COVID. We have systems and processes in place to make sure that those folks are in a safe area to receive the right kind of care at the right time. So we're still functioning. Folks are still coming in the hospital. There's still tons of people that are coming here and having babies. So we're open and ready for business for COVID, and we're ready for that, and we're ready for the non-COVID stuff too.
Very good. Well, I appreciate that, Dr. Greenberg. I would say about the babies, you may get more in 9 months.
That's a tired joke by now, Scott.
I know it is, but I had to go there. I know. And the doctors are laughing politely.
Yeah.
I appreciate
Yeah,
that
exactly.
too, everybody.
Thanks
Megan,
guys.
you had some questions, I know, for some of our guests.
I do. I have about 3 questions, but I think the best transition going off from what Dr. Greenberg said is about testing. And I mean, there's just been so much chatter about it, the ways in which we do test, because I guess there's some sort of blood test, but then there's also like a test that tracks multiplication of RNA or something, and how labor intensive is it? Is there a scarcity, or is it just that it takes time to get these tests back? Can you guys just speak to that?
Yeah, I can answer that one, Megan. I think that's a common and a good question that's floating out there right now. So currently, we have used a number of different testing services. The best test, or the most sensitive test, meaning the test that's most likely to pick up the virus, is what's called a nasopharyngeal swab. So that's when you stick a swab really far back in the nose and get a sample. And this test is called a real-time PCR. And a PCR is looking for any of the viral product. So it's a very good test in picking up a viral product if it's sampled correctly. We're still waiting on what's called clinical sensitivity, which means that people who actually have COVID-19 are testing positive for that, so it gets a little bit complicated. But that's the test we're currently using. That's the test the state and the CDC are using, the NP, the nasopharyngeal swab with the real-time PCR. And we are just starting to get more and more tests in our facility to be able to do it here locally. So it's kind of a moving target. The turnaround time is improving. There's some different aspects to the test, that including reagents and probes that are being continually turned out and delivered. Another test out there is called serologies, and that is what's looking for antibodies. So we're actually working on getting that at our facility too. It's a very useful test to see when people get infected with respiratory viruses. They first develop what are called IgM antibodies, and those come around with most respiratory viruses around day 5. And then the second antibodies, which are kind of the memory antibodies that protect us over time from getting respiratory virus infections again if they don't significantly mutate, are IgG antibodies. And those come around and kind of stay around day 20 and then persist for 2 to 3 years with most respiratory viruses. We don't have all that data yet on COVID, but those tests are very useful in identifying prevalence, or how a community has been infected, and will be very useful, I think, going forward.
So it sounds like one of them is real time, and the other one is more retroactive for the sense of like planning, like is the fall going to be worse? How long is this thing going to hang around?
Yeah, I think that's a perfect way to think about it. Yeah, the real-time PCR looks at active infections, and then I think the serology test will be exactly, as you said, more useful for long-term planning, understanding healthcare worker exposures, et cetera.
Great. There's also been a lot of chatter about medication. At one point, there was talk about, is ibuprofen helpful and fever reduction if you don't have Tylenol, et cetera, as well as like all of this talk with hydrochloroquine and all of that. And so maybe you guys want to comment on that, dispel any false beliefs on that.
Any takers on that one?
I'll take that one too. We're looking at these very intensely, and there's new studies every day on these various issues and things that are cropping up. There's still very limited data on sort of the use of all of them. So ibuprofen, to my knowledge, nothing has changed, but it may be associated with worsening illness, but no societies, again, that I've read recently are clearly recommending against its use at this point in time. The second one, the ACE inhibitors or the ARBs, the ACE receptor blockers, are commonly used for high blood pressure, diabetes, heart failure, a number of conditions. And the American Cardiology Society has actually recommended that we don't change how these are prescribed or how they're being taken currently at this point in time, just because of limited data to date saying that these are actually worsening disease or infecting or affecting the course of COVID-19. To answer your question about chloroquine and hydroxychloroquine, there is some basic science research, and specifically with hydroxychloroquine, that shows that it might improve viral clearance or improve the course of COVID-19 illness. The data is still very, very limited on this. So the public should not, without a physician's order and evaluation, should not be seeking this out. There are some side effects associated with it, and especially when we get into prescribing to large populations, they're more likely to manifest. So I think all these things, we are thoughtfully considering the risks and the benefits prior to changing or prescribing.
Great. That's super helpful. Thank you.
Very good to know.
Yeah.
Thank you, doctors, very much. And Dr. Myers, I also wanted to bring you into the conversation about your work in the Durango area with the Durango Makers Lab that has been helping with some important equipment that you're using at the hospital. Can you talk to us a little bit about those efforts?
Yeah, I'd love to. So right now, one of the problems that a lot of facilities are having is the lack of personal protective equipment, or PPE. And we're in a position where the demand for this worldwide has certainly far outstripped the supply of it. Like all the major hospitals in the world now need as many N95s as they can, as many gowns as they can, as many setups and gears that they can come up with to try and protect their staff. And as a result, the supply lines to obtain that kind of PPE have all kind of fallen apart. And so a lot of hospitals, including San Juan Regional, have taken it upon themselves to try and come up with other solutions to the PPE problem than just ordering it, knowing that it probably will never come if we order it. One of the ways that we did this was we were looking at what was something that could be used long-term and reused and decontaminated between patients. And what we came up with was something that we actually usually use in other kind of emergency situations, like hantavirus or something like that, called a powered air purifying respirator, commonly known as a PAPR. And we, as a hospital, had a few of these kind of lying around in case we had hantavirus patients around, but we didn't have nearly enough for a large flow of patients, to a big surge like we're expecting with COVID. So Dr. Greenberg tasked me with trying to come up with some more of these PAPRs, and I approached the Maker Lab in Durango. They work out of the Powerhouse Science Center there. And these guys are amazing. These are usually guys that kind of run your science camp for kids in the summer, and they like build, couch robots and potato guns and things like that. And instead, what I did is I showed up with one of the PAPRs in our bag and said, "You see this weird machine that has a big hazmat gown on it? I want you to reverse engineer this and build me 50 of them in 10 days."
Wow.
Great. Potato guns to that. I love it.
Yeah, exactly. Much to their credit, they didn't blink, and they just got on it right away, and they immediately started taking everything apart and got a whole team involved and got people involved with production management and apparel design to create hoods, and they commandeered the industrial sewing capacity of most of Durango, involving like bedrock bags and alpaca rafts, and anybody who has industrial sewing capability. They're even getting Osprey backpacks involved as well. To start developing hoods for these PAPRs. They took the filter out of the PAPR that we had and designed new ways of building blower boxes through them so they can produce positive air pressure and blow any kind of viral particles out away from the healthcare worker, while only giving them a supply of filtered air that we know is clean. And within 70 prototype, it was amazing. It was like Apollo 13. They all just kind of like got to it and solved the problem. It was the only time in my life that I felt like I was living in an action movie where suddenly like a group of misfit engineers just kind of listened to me and ran at it.
How about that?
How about that? You controlled the
Yeah.
misfits. That's awesome.
Yeah. Then a few days later, they showed us a prototype, and they put Dr. Greenberg in it and had the fire department hazmat chief kind of do some tests involving like spraying him down with fumes of hydrochloric acid to make sure that he didn't gag. And Dr. Greenberg couldn't smell anything through there because the PAPR was working so well. And then they went into production after we knew that it was a good working prototype, and they got us 50 of them in the 10 days that we had asked them to. So San Juan Regional now has access to far more protective equipment for their staff than a lot of other hospitals because we took it upon ourselves to try and build it instead of going through the normal supply lines. It's
Great.
really a great effort on their side.
Great. And this question might be related to a lack of PPE, but we're hearing a lot of concerning reports out there about people who are dying in isolation. Is that happening here? Is there any way to help that, or why is that happening? Can you speak to that?
You mean COVID patients, Megan? I guess
well,
I'm asking, or just
I've heard of both. Yeah.
Okay.
I don't know what
doctors? Is that
yeah.
something you could speak to about this concern if a loved one is in the hospital, and we know families maybe aren't always able to visit them, but if they are close to passing away, what can be done?
Yeah, and I just want to clarify, Megan, is that what you mean as far as visitors in the hospital, or do you mean people at their homes who aren't able to access care promptly?
Oh, right. I mean in the hospital.
Got it. Okay. Yeah, this is a very, very difficult and unprecedented time. I think we're doing things differently than we've ever done before, and we're having to make these very difficult decisions and consider multiple competing things, including the safety of our healthcare workers, which we take extremely seriously, the safety of all the other patients in our hospital, which, again, we want to reassure the public. We have divided in a way that keeps people safe coming in for other medical issues and prevents them from getting COVID while in the hospital. So we do have a restrictive visitor policy very similar to what has been implemented in other parts of the country, but we are really trying to keep the humanity in it all. And we feel strongly that done with safety and good measures that we can accommodate with limitations these situations, these end-of-life situations, and allow a visitor to kind of say their goodbyes and see their loved ones. So that is how we've kind of developed this policy, but it is a very difficult time. Do you have anything more on that, Dr. Greenberg?
I think that, like Dr. Philpott was just saying, that this is a real challenge to try to thread the needle to protect the staff, to protect the visitors, and to ensure that that folks who may be at the end of life do indeed have the opportunity to connect socially or spiritually with loved ones. And so I think that, like Dr. Philpott said, we're doing our best to figure out creative ways to accommodate those needs, and we will continue to try to adapt and to provide for those as this unfolds.
That's great. Thank you.
Thank you all very, very much. I imagine it's a very delicate balancing act, again, as Dr. Philpott was mentioning, about the safety of your staff and other patients, and then the requirements and the humanity of trying to be decent people and get folks and family members and in to see loved ones. So we definitely understand that. We just have a couple of minutes remaining for all of you doctors. I just want to ask, we talked a bit about this predicted surge that may be coming, and again, is there anything that you can share with us about where we are with that? Are we still a couple of weeks away? Is it still hard to tell? I know the numbers seem to be steady, but I don't seem to be seeing a lot of big increases. But again, I'm not on the front lines like you all are. What can you tell us?
Well, I think that's a great question. Scott. And I do think that what's important is that what we may have been doing, actually, is we may be witnessing, in the absence of this big spike, we could be witnessing some of the success of the social distancing. And, I think that, because what that'll do is that'll prolong this, but it will preserve the healthcare infrastructure, so it won't be overwhelmed. Now, that being said, I think that it's super important for folks to continue the social distancing practices and to really to heed the guidance from the governor's office and to make sure that folks are really doing their best not to go out and about. I think that we still continue to anticipate a sustained increase in demand for healthcare services. We follow a series of different models. Some of them are from Los Alamos National Laboratories, and which is the one that is looked at by the state and also the University of New Mexico, that still projects that we have a little bit of a rocky road in front of us in New Mexico. There are a number of other sort of statistical models that both show worse and they show not quite as bad. So it's difficult for us to interpret kind of what that all means. It still continues for us to mean that we need to remain prepared and vigilant and ready to care for those that may come in our doors and seek care. But I think that it is difficult to understand where we are. But I think that even though things have perhaps not taken off or skyrocketed as people are really concerned about, that's really a product of everyone's effort, everyone in the public, taking these warnings very seriously, and I strongly encourage everyone to continue to take these warnings seriously and to continue to engage in the social distancing as much as possible, so they can stay healthy and other folks in our community can stay healthy as well.
Well, I think that's good advice, and I think as we heard maybe from Dr. Fauci nationally, it was that we can't control the timeline, the virus controls the timeline, and I imagine you would all agree with that too.
Absolutely.
Absolutely.
Yeah. Well, great. Well, doctors, we will let you go. I appreciate you calling in today. I think Megan appreciates it too.
It's
I
my
always
favorite.
say that. I apologize.
Yeah, exactly. Scott appreciates it, as do I, guys. It's
Yes.
actually my favorite part of what we get to do on this program. So thank you.
Hearing directly from you all. So thank you for sharing your expertise with us. And you all, please, again, extend our great thanks to your coworkers and colleagues there at the hospital. And do stay safe for all of us. Thank you.
Great. Thank you very much.
Thank you very much.
Thank you very much. Our guest this morning here on KSJE on our local information program, again from San Juan Regional Medical Center, our great thanks to Dr. Aaron Philpott, Dr. Jared Myers, and Dr. Brad Greenberg. And we are back here at our studios as we talk about what's going on today. We thank them for their time, right? Our
Yes.
doctors are great.
Yes, they're great.
Yeah. So
Truly.
Wonderful to have them.
Perfect for the science nerds over here.
Exactly,
Yeah.
exactly. But answering some good questions,
That's
know,
right.
and important questions that we wanted to ask them. So, so that is important. And then I want to look at some of the numbers that came in yesterday. Again, on our website, ksje.com. We are compiling all the latest numbers from the state as we get them. But again, as we kind of watch for either a surge or a peak or whatever you want to call it,
Both,
cases
I
are still
think,
coming
yeah.
in. And so 80 new cases in New Mexico yesterday. Of those, 11 were here in San Juan County, so now we've hit the 200 mark. But however, no new deaths reported yesterday, either in the county or in the state, which I think is significant.
It's significant, but as we were saying, so I think you surge up to the peak and then you decline. So, I mean, it is significant. Obviously, you want to cut down on as many deaths as possible, but cases equals influx of possible chronic, hospitalization. That being the problem.
Right.
So,
but again, as the doctors were saying, they still have capacity.
They do. We do.
And that's good.
That's great.
In New Mexico and in San Juan County. So,
yes.
That's important as well. The recoveries are up by 13.
Yeah.
Again. So
good news.
So there is that. And then as we
that's statewide.
Exactly.
Yeah.
As we scroll down, we have the link there to the New Mexico Department of Health's website, and that from there is the dashboard that we showed yesterday on the show. It's giving a lot more information. Navajo Nation cases, again, that's still a big concern. I know for a lot of folks, both on and off the reservation, they had 83. Yesterday, they are approaching 1,000. They're over 900 cases, 5 more deaths. again, on the Navajo Nation being reported yesterday. So again,
That's yeah. I mean, 1,000 on the Navajo Nation. I mean, that's
that's a lot.
It's a whole lot.
And when you look at it
The
proportionally,
total population.
Right.
Yeah, that's what's crazy.
they are one of the top areas in the country
Yeah.
for
Jeez.
cases compared to population. So there's the story about the first responders, as we talked about earlier, this program about the 911
Yep.
changes, and one new case in La Plata County. So we're sharing that again on our website. So there you go, everybody. Let's hear from Congressman Lujan.
That's right. Yep.
Shall we? Here he is. Joining us now from his home in Nambe, New Mexico, Congressman Ben Ray Lujan is here to answer some questions about how the federal government is helping with COVID-19. And Congressman, thank you for joining us.
Good to be with you, Scott, and good to be with you, Megan.
Thank you very much. We'll start by Megan, if you want to start with the first question.
Sure, yeah. So I'm looking through some of this legislation that you're working on, Congressman, and one of those pieces of legislation says that 1,793 New Mexico healthcare providers will receive more than basically $169.5 million in aid to fight against the pandemic. And can you just break down what that looks like? I mean, when I first read it, I was like, does this mean my doctor's getting a check in the mail, or how does this work? So.
Yes, so in the third piece of legislation that was adopted, which has been referred to as the CARES Act, we initially passed an $8.3 billion emergency response. We then moved to the second piece of legislation, which provided additional support for unemployment insurance as well. And then the third package, which was the $2 trillion package that included support for small businesses, also included support for direct payments to people across the United States and New Mexico, but also financial support for our hospitals and public health facilities. And so the idea here was recognizing that how hospitals were going to be inundated because of the coronavirus. There's going to be challenges with social distancing, and we've since seen that procedures that are deemed non-emergency or non-essential procedures are also being rescheduled and put down the road. So the revenue for the hospitals has dropped dramatically. So the infusion of financial support to New Mexico hospitals, which was included in that release, helps them not just provide for more support with acquiring PPE, which we know has been, there's been a shortage across the country and a shortage across New Mexico. That it also helps them with the loss of revenue to be able to help keep more people working during these tough times. But we also know that it's not enough. What we as Democrats in the House and Senate have been advocating for the next package, which could happen in a matter of days, includes $100 billion for hospitals, for small rural community clinics across America, understanding the strain that they're facing. There were announcements even this week of a number of hospitals in New Mexico who have furloughed employees as well.
And that's true. That happened here in Farmington, Congressman, as I'm sure you're aware. So interesting.
Yeah, and another one was the $250 billion in direct relief to communities impacted by COVID-19. And you had mentioned that it's especially critical for rural communities, which makes sense. I'm wondering if the Farmington area qualifies as a rural community, or so you might want to break down that relief for us too.
Absolutely. So in CARES 3, when the negotiations were taking place for what was called the State Stabilization Fund, understanding that states across America would need additional financial help with the closure of schools and small businesses to encourage more social distancing so that we could stop the spread of the coronavirus throughout New Mexico and throughout America, it was recognized that there needed to be direct financial support. There was something buzzing there. Sorry, it got my attention. That there needed to be direct financial support for states and for local communities. But in those negotiations, somehow this notion of local governments, meaning cities and counties, unless they had a population of 500,000 or greater, would they be able to qualify for direct financial support as well?
Wow.
Well, that makes no sense to me, especially in a state where only one of New Mexico's 33 counties, being Bernalillo County, would qualify with having a population of 500,000 or greater.
Exactly.
So the legislation that I proposed said, look, you shouldn't have caps. There are many small communities across America that need that direct financial support, and especially now that we've seen gross receipts tax collections drop because no one's shopping or able to shop, or fewer people out and about because they're doing the responsible thing of practicing social distancing, that they need direct financial help as well. So in fact, San Juan County and Farmington and Bloomfield and Aztec and every other small community, town, city, and village in San Juan County would qualify if my legislation that I worked on with other colleagues, we're now over 107 co-sponsors. One of our Republican colleagues out of Colorado, Scott Tipton, recently joined, and we're hoping that will prompt more Republicans to co-sponsor our legislation as well, so that local governments that need the financial help, and they all do, can all benefit. And so it's one of those areas where, many of us from smaller, more rural communities, we're the leading voices on this, and we're encouraging our colleagues that represent the biggest cities in America to please help us with this initiative, so that way no one is left out during this emergency and during the coronavirus, which no one brought on through themselves. This is something that has continued to spread and doesn't have any boundaries.
Great. Well, thank you. Thanks for sticking up for us, Congressman. We appreciate it.
Absolutely.
Mr. Lujan, I know you're also working on some legislation about price gouging and to try to protect against that during these times. Has that been a big issue across the country?
It's been a horrible issue, and the more healthcare providers that I visit with, the more concerns that we have with entities out there that are price gouging when it comes to accessing PPE. So those masks that our healthcare providers need, face protection, rubber gloves, not just for healthcare providers, but also for everyone that's deemed essential that is working on the front lines. Think about everyone working in grocery stores that's stocking, or they're checking us out when we're buying those groceries now as well. PPE is needed across the country, and sadly there are entities, companies out there that have been preying upon the most vulnerable during these tough times. So the Attorney General of New Mexico, Hector Balderas, has been very aggressive in capturing information showing where there's price gouging taking place. Attorney Generals across America have been doing the right thing in pursuing those efforts, but that's one of the reasons and why it's so desperately needed for us to have legislation to go after these bad actors when it comes to price gouging and taking advantage of a national emergency like the one we're facing today.
Understood. And Congressman, I want to ask you a little bit about the Navajo Reservation, because, of course, as you know, the virus is really hitting that area hard. It's hitting all of northwest New Mexico hard. We just heard from the governor saying 75% of the cases that were reported in our state this week have happened here in San Juan, McKinley, and Sandoval counties. I know dealing with Native Americans is more of a federal responsibility. Is there anything that the Congress is doing to get more supplies to the health agencies on the reservation, or helping the tribes and pueblos in our state?
So the one of the early pieces of legislation also included direct financial support with a tribal government stabilization program as well. It's the first time something like that had been established. Now, the problem with it, though, is what we were advocating for as members of the House of Representatives, and what we actually had moved forward in our legislation as introduced, was substantially more than what ultimately made it in the Senate negotiated package. So we originally were advocating for $20 billion for the Tribal Stabilization Fund. Ultimately, what was included was $8 billion. We've heard more and more reports this week that most of that money seems to be going to Alaska Native corporations in the state of Alaska. And so we're digging in to try to get more facts associated with that. Several publications, including the Wall Street Journal, wrote articles about it over the last 24 hours. So a lot of that financial support should have been making its way to more and more Native American communities. Now, the challenge that we're facing on the Navajo Nation that we have been working on with President Nez and the Vice President, as well as the legislative branch through the Speaker's office, is the Navajo Nation, not just in 3 states, but in several regions with FEMA. And so a lot of these agencies, whether it's FEMA or IHS, are not collaborating and working together and getting these direct payments done in an efficient manner so that the Navajo Nation has direct access to the financial dollars that have been made available. So that's been a big problem as well, in addition to it being a rural community. And this is one of the things we've been raising with our colleagues across America, with the Navajo Nation, many other Native American communities, rural communities. And one of the cities that has received the most attention around this is Flint, Michigan. That means what I'm trying to convey is the lack of access to water, to clean water, to water for you to drink, to bathe with, to wash your hands with. And we know that especially in To'Hajiilee, that there has been a shortage. There's 6 wells that provide water into the chapter of To'Hajiilee, and 5 of those wells have gone dry as a result of the usage. So there's only 1 well that is being made available or that is still usable. The National Guard has deployed a truck predominantly for watering animals, and then there's bottled water that is moving into the community, but nowhere near what is needed. So as part of these packages, when we look at the shortage, the lack of availability of clean water, that's why many of us have been saying we need an infrastructure emphasis to make sure we're able to get water, support for these wells that have gone dry, whatever the delivery system would be, so that we were able to get water into these communities. So one challenge after another with making sure that we're able to get more support into areas like the Navajo Nation with our Native American brothers and sisters and Navajo brothers and sisters there, and why the next package needs to have more support for Native American communities, especially the Navajo Nation and the pueblos in New Mexico, where we've seen an increase in the number of COVID-19, of coronavirus cases as well.
Right. Well, Congressman, I know we're almost out of time. Speaking with you today, I wanted to ask you, though, your predictions for some of this new legislation that's coming up. We saw pretty bipartisan support the last time. Do you think your colleagues across the aisle will meet you halfway and we'll see something getting done here in the next few weeks or a few months? What do you think?
Well, I'm hopeful that there'll be continued bipartisan support, but here's one of the challenges that small businesses, for example, are facing, which is where the emphasis with the next package will be. Small businesses across America, we're being told by Secretary Mnuchin that the small business payroll loans, that they could run out of money by today. And so that's $349 billion. But the challenge for New Mexico is we were finally able to push the Secretary of Treasury, Mr. Mnuchin, to get disaggregated data by the state level. And we're still trying to get it regionally within the states so we know where these loans are going. In New Mexico, what it showed is there's been an approval of about $1 billion. Now, if you break that down by population, New Mexico is short by between $500 and $600 million. The small businesses should have been able to get through this program. And so many of us are concerned that we're still not seeing the level of support flowing from the SBA to small businesses in New Mexico. We're looking at how these loans are being approved, what the backlog is. And so the next level of packaged funding, as being recommended by Mitch McConnell and Kevin McCarthy, the 2 Republican leaders in the House and Senate, is a $250 billion addition to that program. There's many of us that are concerned that there is not enough funding going to community banks, local banks, and local financial institutions that have more relationships with these small businesses. So what we're saying is, okay, $250 billion, but $125 billion goes to the smallest lenders in the country, these community banks and local financial institutions, so we can get more help to financial businesses or to small businesses. We also need help for those hospitals. So we've advocated for a plus-up of $100 billion for hospitals across America and community health centers, as well as $150 billion plus-up for local governments and state and tribal communities for that stabilization fund. And that's where Mitch McConnell has refused to accept what we've put on the table. We're hoping he will. And that'll be the next package, a hybrid of that, while we start working on CARES 2 as well, which may have some infrastructure aspects to it.
All right. Well, Congressman Lujan, I appreciate your time with us this morning. Thank you very much. And thanks for doing the work that you are in D.C. And when you get back there, be safe.
Thank you as well, and thanks for staying safe, and look forward to seeing you someday soon in that studio again, sir.
All right. Very good. You're welcome anytime. Thank you very much.
Thank you, Megan. Take care.
Thank you.
Congressman Ben Ray Lujan, our guest here on KSJE. And we're back in the studio, of course, on our COVID-19 local information program. Scott Micklin along with Megan Cullop. So, big show today.
Yeah,
we have
powerhouse
lots of
show.
folks, right?
That was really cool.
We're going to open the phone lines on our remaining minutes here this morning, everybody. If you would like to just call in with a comment or a question, or again, let us know how you're faring
Yes.
with the COVID-19 and lockdown, staying at home,
Yeah.
essential travel, essential shopping, that kind of thing. But we want to leave with something positive, as we always do.
As we always do.
Right.
So, yeah. So yesterday I sent out a plea for masks for the San Juan local detention center,
I remember
adult
that.
detention center. And today I get to go pick up 50 of them.
Hey,
That
how
was
about
a
that?
quick turnaround.
Look at that.
I know. That's amazing.
That's
so,
terrific.
Yeah, so people are really responding to that, which is nice. I mean, obviously we've prioritized different facilities, and
Of course.
it's great that people are stepping up to help those folks as well. So
That's wonderful. Well, good job, community, as
job,
we always
community.
say, and we're proud of
As
we're
they
proud of
always
everybody.
say.
Well, I think we do.
we are. Yeah, there's a lot of ways that people are stepping up in their own way, even if it's just trying to follow the quarantine rules
Right.
to a T. That's a way that we step up, and
Exactly.
so.
That's important. But anyway, so we're going to wrap up the show today, everybody. We will be back on Monday with our next program.
Yes.
And of course, we'll provide updates on the website if things develop over the weekend or the next couple of days. So you can join us next Monday at 9.
That's right. And send us whatever questions, ideas that we could tackle on air. That'd be fun too.
Yeah, exactly. So very good. Thanks, everyone. Thanks for joining us. I'm Scott Micklin. I'm with Megan Cullop. And we will see you on Monday. Stay healthy and stay safe, everyone.